Right.
So I promised you that I'll show you the signs and symptoms of food poisoning and how to even handle yourself when you have food poisoning. So let's go right into it. Number one, the signs and symptoms of food poisoning includes diarrhea, vomiting, severe abdominal cramps. So these are some of the classical symptoms of food poisoning. And mostly these symptoms manifest after the other. Mostly you will see the diarrhea before the vomiting, and the abdominal cramps comes in later. So the diarrhea mostly occurs within 12 hours to 24 hours of the gastroenteritis or the food poisoning, then followed by the vomiting. In some cases, the two occurs together or simultaneously, but most of the time your diarrhea will start before the vomiting. And due to the cause of your food poisoning, if it's caused by a virus, rarely will you see that you are having increase in temperature. If it's caused by a bacteria like Salmonella, like E. coli, or if it's caused by a parasite like Giardia lambda, then you are highly likely to have increase in temperature mostly after 48 hours. Then after that, your stool nature or texture will also determine whether you're having a bacterial infection, a protozoal infection, or a viral infection. Most of the time, the bacteria and the protozoal infection has phlegmy stools, and the viral will have watery stools. These are some of the classical symptoms of food poisoning. Now, how do you manage yourself in the house when you're having food poisoning? Number one, make sure that you hydrate more. Then number two, you make sure that you consult your healthcare provider so that they will know what exactly is happening to you. Because one of the classical things that can happen to you is that you go into dehydration, and dehydration can lead you into coma. Severe dehydration can even let you die, because as you are losing fluid, you are losing glucose, and also you'll be going to hypoglycemia. That means your blood sugar begins to drop, and when it goes beyond a certain threshold, you can go into coma, and you don't want that to happen to you. So you want to hydrate more and also report to the nearest healthcare facility. If the food poison is caused by bacteria, or if it's caused by a protozoa, your healthcare provider will prescribe certain antibiotics after a stool sample has been taken to know the cause of your food poisoning. But make sure that you report mostly to your healthcare provider, and they will get you sorted. Food poisoning is treatable, but it is also dangerous. Make sure you always have activated charcoal around you. It also helps with food poisoning, at least as a first aid, because it absorbs most of the poisons and it reduces some of the symptoms that you're having. But that doesn't mean that you shouldn't go to your hospital. Do not self-medicate when you're having food poisoning. It's one of the bad things to do. Stay safe out there. Practice good and clean personal hygiene. This is Connected Dr. Greg. Stay tuned for my next video.